Welcome to the second video of our current trends in hypertension series. Today we're going to discuss when to treat high blood pressure. I'm Dr. Mohammed Tinawi. I'm a nephrologist in Northwest Indiana. Let's review these definitions from the last lecture. Normal blood pressure requires a systolic blood pressure below 120 and a diastolic below 80 millimeters of mercury. Elevated blood pressure is a systolic blood pressure between 120 and 129, while the diastolic remains below 80. Stage 1 hypertension or high blood pressure is a systolic between 130 to 139 or a diastolic blood pressure between 80 and 89, meaning if you have a diastolic blood pressure of 80 alone, you have high blood pressure. Stage 2 hypertension is a systolic blood pressure 140 or above, or a diastolic blood pressure 90 or above. Before we start talking about the treatment of high blood pressure, we need to estimate the cardiovascular risk factor. So we have this ASCVD calculator. I'm going to provide a link in the description. And you just enter data about the age, the sex of the person, the systolic and diastolic blood pressure. You need information about cholesterol, about diabetes, smoking status, whether the person is using high blood pressure treatment, whether they're using a statin to lower cholesterol, whether the individual is on aspirin. And after that, you are going to get a score, meaning the probability of having an event, a cardiovascular event within the next 10 years. After we get a blood pressure reading that is elevated or in the hypertensive range, we need confirmation. The best way to confirm high blood pressure is to do ambulatory blood pressure monitoring. This is not always feasible. We can do home blood pressure monitoring, meaning the patient can measure his or her blood pressure at home several times, or we can do the confirmation in the office. We can get an automated device and measure blood pressure 3 times, maybe 2 minutes apart, and the patient is alone in the room without being observed. We can do that over 2 visits for confirmation. Obviously, if you have someone with very high blood pressure, say 170 over 100, with evidence of target organ damage like chest pain or chronic kidney disease, retinopathy, you're not going to wait for confirmation. You're going to take action right away. Now, these confirmations are useful also in 2 conditions. Masked high blood pressure is when you have high blood pressure at home and normal blood pressure in the office. This is why you need office and out of the office measurement. While white coat hypertension is when you have normal blood pressure at home and high blood pressure in the office. After we confirm that the person has high blood pressure, we need to start everyone on non-pharmacological therapy. So everyone with elevated blood pressure should go on that, and everyone with high blood pressure should go on that, whether or not we're going to use medications. So these things are the only things that work. Everything else actually doesn't work. Weight loss, very helpful. Heart healthy diet, like in the DASH, there was a study called Dietary Approaches to Stop Hypertension Diet. That's very useful. And this is a diet high in plants, fruits, has low-fat dairy products, low in fat, low in sodium, and actually this diet can lower blood pressure by 10 to 11 points. So that's very useful. Low sodium diet, meaning below 2,000 milligrams per day. High potassium diet, about 3.5 to 5 grams per day, preferably from fruits and vegetables, not from supplements. Patients with chronic kidney disease should not go on high potassium diet because they can have high potassium hyperkalemia. Exercise, very useful, about 30 minutes per day, 5 days a week. Limiting alcohol intake to 2 drinks or less for men and 1 drink or less For women, if someone doesn't drink, that's even better. One drink is like having one beer. Tobacco cessation to reduce a cardiovascular risk in general. So we confirmed the reading. We did recommend the non-pharmacological therapy. Now, when do we treat? So if we have stage 1 high blood pressure, systolic blood pressure 130 to 139 or diastolic 80 to 89, we should do these non-pharmacological therapies and calculate using the calculator I just mentioned the cardiovascular risk. So if it's below 10%, we just recommend non-pharmacological therapy and repeat the evaluation in 3 to 6 months. But if the risk is over 10%, then we should start drug therapy. And drug therapy can be with a diuretic, with an ACE inhibitor, with an angiotensin blocker, or with a calcium channel blocker. And we can talk about that in a separate lecture. Now, if we have stage 2 high blood pressure, systolic over equal or over 140, diastolic equal or above 90, then in addition to non-pharmacological therapy, we should start drug therapy right away. Then you don't wait, you evaluate in 1 month. Preferably, you should start with 2 agents to reduce the blood pressure, so medium doses with 2 agents. And the higher the blood pressure, the more compelling the reason to start with 2 agents. I'm going to stop here. We'll see you in the next video.